Now, I trust that you can see my screen today. I know we had some technical difficulties last month. So why don't you go ahead and text me a message, and I'll be watching now in the message box if you cannot see my screen. All right, so today it's probably a little bit of a shorter call today than we've had in others. Things are quieting down a little bit. Maybe you're finding that as well. So we'll talk about Co-Opportunity Health, a little update there, some healthcare reform updates, and then some miscellaneous items that I want to go over with you guys. So I think, first of all, I want to talk to you a little bit about what's going on with Co-Opportunity Health. And I was on the Insurance Division website, so any additional information that you want, you can certainly find it there on the Insurance Division site. But I wanted to make sure that you guys were aware of how, the importance that the Insurance Commissioner now is stressing for all clients to get moved off of Co-Opportunity. So I know some of you had some folks that were just hanging on and holding on and they didn't want to move. So hopefully most of your block of business has been moved to another carrier. I found it interesting here that they really talked about, they expect the court order to come and the liquidation to be effective February 28th. So that's just a couple weeks away. And I found it interesting the way they outlined about 5 particular consequences from the liquidation. So just so that we're all familiar and comfortable with what's going to happen here if these clients don't move. And maybe I'm preaching to the choir and you guys have everybody moved already, but if you don't and you've got some of those that are hanging on, remember the advanced premium tax credits or their cost-sharing reductions, whichever program they might have been under, will stop. Individual policies will be canceled 180 days after liquidation. So, and remember too that there's, I'm going to jump down to the bottom there, this does qualify for special enrollment period. They'll give them 60 days following that, the liquidation to find coverage. So if it's after February 15th, which is the end of the annual open enrollment, of course, they'd still have some time to get coverage, but it's just a grave concern here, obviously, for the client. Of course, the limit of the $500,000 from the Iowa Life and Health Association, that is a limit. And, of course, we know with healthcare costs, if something tragic should happen, that may or may not cover all of their healthcare costs. And I found this one interesting, that once they liquidate, the credit for deductible amounts that will not be given. So the movement now, is critical to get that taken care of. We know that's true on, there's not possible on any individual policies ever, but they're even saying here it may not be credited toward any other group policy either once the company has gone into liquidation. And of course, there could be tax penalties if people don't get in on the individual side, et cetera. So, so just again, make sure that you guys are getting in front of those clients. If there's any more, and or there might be some folks that aren't even your clients today that are looking for some assistance. And good, I want to make sure you guys are seeing the screen. Thank you for replying to that. All right. So the other thing I think is important that we hear exactly what the Insurance Commissioner said. So I want to make sure that you guys hear his language when he talks about making sure that people are getting moved as soon as possible, and also encouraging them to talk to a licensed insurance agent immediately. So I found that to be encouraging when he is directing folks to us and sees the value that we provide out in our communities. And yeah, it's obviously, we know in the individual market, it's moving them to Coventry as soon as possible so they can maintain their tax premiums and the assistance that they're getting there. So anyway, just wanted to make sure that you saw that. And as I said a little bit earlier, the annual open enrollment ends on Sunday, which is kind of awkward, right? And so you may be still meeting with some clients over the weekend. So today, obviously, we'll be in the office until 5 to help you with any questions that you have. I did talk to some of the staff this morning, and we'll be pushing out today a notice. If you do write any policies over the weekend, what do you need to do to get those in and get them credited, where you need to send your information. So watch for a news flash KHI sometime today to help you if you have any of those sales you're working on over the weekend. The other thing, and this again was around the IRS, so now I'm really going to refer to some of the updates that I talked to you guys about last month on healthcare.gov, or excuse me, hrsolutions.com. That's KHI's HR portal, and I know I asked Tricia and Nakia afterwards, and they got a nice flood of calls from you guys after our webinar last month to get yourselves signed up on KHI's HR Solutions. And I'll tell you, that has such a breadth and depth of information. So a lot of times our calls, I will refer to that as I go out among the internet and try to find applicable information to keep you guys updated on. But this piece right here, the IRS releases their final forms and instructions for employers to report health coverage and ACA compliance. So remember here, too, that because of the transition relief provided for 2014, it is voluntary reporting for 2014. They'll be not subject to any penalties if they begin their reporting in 2016 for 2015 year. So if you want more information, anytime on these presentations where it says transition relief or it shows something that's underlined, there's a hyperlink there on the website where you can get more detail. So if I give you pieces of some information, don't forget you can get it on the HR Solutions portal when you log in with your login. And remember, that's also a benefit if you have any small groups or large groups. It doesn't matter, any size group. If there's an HR contact that would find value in this, and I believe they would, make sure that you let Tricia know that you'd like to give one of those to your KHI group that you run through KHI. So the next one I wanted to mention about here, too, is they're calling it limited penalty relief regarding the advanced payments of the premium tax credit. Now, what this is referring to, you guys, remember when we sit down with folks and they qualify for a subsidy, and we tell them that it'll be trued up at the end of the year when they do their taxes. And I think because this is the first year now, we're in 2015 looking back on 2014 trying to determine, okay, how much money really did I make, and did I really qualify for that much subsidy? Or really maybe I qualified for more subsidy. I made less than I predicted, right? So this is the time this true-up is going to happen. And the IRS has released this notice. Now, they don't provide relief on the actual tax that they might owe, right? They found out that they owed more in premiums, right, than what they thought. In other words, they made more money than they expected, so their premium subsidy went down. And they might owe more. They'll still owe that, and they'll see that on their taxes. But what they're saying here is there will be limited penalty relief for some of those folks. In other words, if you didn't pay enough, they're going to withhold any penalty, is really what they're saying. So you're still going to owe the tax, right? They're saying here that as a result of reconciling all of that, and as you know, I know I've done some taxes in the past where if you don't pay enough, right, into the taxes here, there could be a penalty. You should have paid more in. And what they're saying here is there's going to be some limited relief on that penalty. I just want to make sure that you guys were aware of that. This is really where the rubbers start to meet the road, you know, what we talked about last year. Okay, so now this one we talked about last month, but I wanted you to see it, that it is actually in print. It's all official through the IRS, because as you know, that's where all of these subsidies, premium tax credits, and all that is generated through our tax returns. So this now is referring to those co-opportunity small groups that had that were really interested in getting that premium subsidy and through the shop. Now, many people that maybe bought through co-opportunity but didn't qualify for the shop, you know, premium tax subsidies, but there were a lot that did, and were quite upset when there was no other alternative to move to maintain that tax relief. And so they did get an exception. And so there, again, they call it transitional relief. For those small employers in certain Iowa counties, it is the majority of the counties in Iowa. And you can, when you click on the transitional relief, which I did this morning, you could actually get a list of all the counties, and you can see exactly where it's written in Iowa. They're getting this relief so that if a small business health options program group, a shop group, would like to maintain that additional tax for the rest of the year, as long as they go with another group in these counties in Iowa. So it could be Wellmark, it could be Coventry, it's UHC. Even though they're not a qualified health plan in the shop, they'll be able to get that tax, premium tax subsidy that they were counting on only through the end of this year. And even if it was only their first year of taking it, they will get 1 year and that's it, even though the tax subsidy allows for 2 years. They'll only get this relief through the end of this year, and then that's it. In more detail, again, you can go to the site and then click on that link. One of the other things that I think we forget about sometimes, when you're doing your employee meetings and meetings with employers, many times, especially now I'm talking about the small group market again, and if you are giving them some of their what I'll call extra packets, right, for their employees that might come on as they hire people throughout the year. So hopefully you're giving them the information, a copy of the carrier application. I think this model notice is a great thing to also remind them, especially if you've taken over a new group. There's a lot of AORs going on right now. There's a lot of small groups out there that are not getting the service and support from their agents. So make sure if you're looking for those opportunities or you've landed a new case or it's one that you've had, it's a good time to remind them to put in that model notice in their new hire pack that might have the explanation of the health plan, hopefully perhaps the SBC they have in there, as well as this model notice. You'll see also on the link, again, I've put this off of the KHI's HR Solutions portal. You can pull it down in PDF, you can pull it down in Word, you can even generate a copy in Spanish. And I know that's applicable for a lot of us with our groups out in the marketplace. Okay. Remember, too, there's 2 different notices. So there might be an employer group that you might have their property and casualty, and you don't have their health, they don't offer health, right? Give them this model notice. They still need to provide it. It's a Department of Labor standard. It has nothing to do with whether you're offering health insurance or not. So notice the 2 different model notices there for employers who do offer coverage and those who don't. So both of those are out there. Again, if you need any help, just holler at our staff. Get on the website and get those pulled down on the HR Solutions website. I want to show you where that is, because some of you that may say, how do I get there, Lynn? I forget. When you go to, you can get there either from KHISolutions.com, or hopefully you guys are all using the agent portal at KHIagents.com. And then you'll notice when you go right in here to the Agent Solutions tab and click down to HR Solutions, that's going to take you to the login page for this portal that I'm referring to. And so I'll go to the next slide, and this is then where you end up. So make sure, and we talked about it last week, but this is where you're going to find that information. And as you begin to get more familiar with this, then share this with those small groups. I really believe that if you're not using this, you're missing an opportunity to really score some points and show that value with your client. Under the miscellaneous category, I kind of want to talk to you guys a little bit about, we're not doing this. I think a lot of small groups are not doing this. And so let's make sure that they're staying compliant with providing. There's really 2 parts to this, so let's go through the first part. The first part is there's an online form where employers who are offering prescription drug coverage to those that are Medicare Part D eligible inside of their company, they need to go online and disclose that to CMS to let them know that they are providing credible, whether or not they're providing drug coverage that is credible or not. As we know, what happens when you've got someone that turns 65 and they continue to be employed, and I don't know about you guys, but we're seeing more and more of that, right? People are continuing to work past the age of 65. They're not automatically getting their Part B and jumping onto a supplement. Many of them in particular, they're continuing to work, or their spouse, and a lot of it have to do sometimes with drug coverage. A lot of employer groups offer better coverage than what they can get standalone Part D. And so make sure that they're doing this, help them through this. And then the second part of this, I'm going to the next page here, the second part of this is making sure that they are offering this to their employees. So So remember that they are, under the law, it says employers whose policies include prescription drug coverage must also provide a written disclosure notice to all Medicare-eligible policyholders of whether that coverage is credible or not. So this is so helpful. For those of you that play in both small group and individual market, when you are going through your employee census, whether or not you're at renewal or now's the time to look there again, make sure you see who is going to be turning 65 on that employer group this coming year, and provide this added value to that client to make sure that they're staying in compliance. And it makes it so much easier also for that person, that employee that's turning 65, to be able to evaluate their options. And then, as I mentioned, if you also offer individual policies, it's just a great segue when you're helping to provide this information and you know that they're going to be turning 65, and you can offer to that HR representative. I'd be happy to have someone from my office contact them, or you, or you've got an associate that does that, to help them through their choices for turning 65 and getting Medicare, et cetera. So just another good, see some of these things, and maybe we can take a breather now that we've gotten through a lot of the chaos, and go back and make sure we're following up and doing some of these things that maybe we should have been doing but maybe got missed in the hubbub and the hustle of everything we were trying to do to get all these groups enrolled and et cetera. Again, more information on the website should you need it, but a couple of good pieces here. Also, kind of under the miscellaneous category, I want to throw out a couple of things. On the private exchanges, you know, we hear a lot of talk about private exchanges, and a lot of the bigger retail firms have these private exchanges. We've maybe heard of Holmes Murphy having a private exchange, or some of these other larger firms. Mercer might be another example of that have these private exchanges. And the whole nature of a private exchange, you know, from all the research that I've done, it's really about trying to keep that client in-house. It's keeping them under your wraps, so they don't go out and start perusing, trying to find their solution somewhere else. Right? They're finding them just from you. Well, when we look at it from an independent agent's perspective, and now as KHI being your general agency, we look at them just a little bit differently, because we know that in our research, the private exchange for us is trying to really, I'm going to kind of paraphrase it here, and what we're looking at here on that bullet is looking at tools to assist you in quoting and enrolling individuals and groups. Now, that doesn't mean that in other words, you know, look, right now we know in the individual market, we really are limited to 2 carriers, right? Since Co-Opportunity left, we've got Coventry and we've got Wellmark. We know UHC with their Golden Rule Company does not have products in Iowa. They might have a short-term, I think they still have a short-term product, but let's just talk about, you know, those types of coverages that people are looking for today, the longer-term individual coverage. So today, you have to go out to Wellmark's site and pull a Wellmark quote. Then you go out to Coventry's site and pull a Coventry quote. Now I'm trying to lay those side by side to share with the client, and the formatting is all different. So what we're looking at for you is a tool to be able to do that quoting on one site. You enter the information one time, and it pulls that information in. And so be able to not only get a quote, be able to share with a customer, but how about having the electronic capacity to have your login associated with that link, right, that you're possibly doing that proposal, so that when they complete it electronically, everything is getting credited to your account number, your agent number, if you will, whether it's Coventry or through Wellmark. So we're looking at that solution on the individual side, and then on the group side, the same thing. Now we're trying to do, in our office, we're even looking at, this is our value add to help you with these quotes, even though some of these you can do yourself. We help you with your Coventry quotes if you write your Coventry to us. We've got access to do that ourselves now, where we can log in and actually pull that quote and not wait for anyone else to get that back to us. So we have Coventry, of course, Wellmark, and United Health. United, we still, as far as I know, we still, you know, reach out to United Health to get the quote generated for us. But now we've got those 3 carriers. How can we do the same thing I was just talking about on the individual market? How can we do that same thing on the group market, where I enter that demographic once, especially upload it, right? And then have it pull the information from all three of those. How cool would that be, right? Now, we're doing a lot of this work behind the scenes for you, trying to gather this information and then put it into a template, a side-by-side template. But we're looking at that tool to be able to, of course, make our work more efficient so we can be more responsive back to you and improve accuracy, right? As a lot of this stuff ends up being manually entered. So then, not only take it that, what I just talked about with quoting, but then being able to actually the enrollment. So just know that we are looking at this, and you can call it a private exchange, but I'll tell you this. I'm going to call this a quoting and enrolling tool, and here's why. Because up to this point in time, Wellmark has refused to be part of any private exchange. Now, that was the last I've known. If anybody knows of anything differently or Wellmark has allowed themselves to be on a private exchange, I had somebody tell me yesterday, but Lynn, Wellmark is they're on eHealth. If you go to eHealth.com, you can get a Wellmark quote, and that's online. And isn't that a private exchange? And my response back is, Wellmark has contracted with eHealth to be a distributor, just like KHI, just like you are. I mean, they're another channel for Wellmark to move their products. So that's not necessarily a private exchange. That's another general agency, like a KHI or anyone else representing Wellmark, right? But as far as I know, that's the only electronic source that you can source Wellmark other than going to their self-service site. So since Wellmark has said we are not allowing our system to accept electronic enrollment from anywhere else, we're doing we're looking at another firm here that's got a very, very interesting value proposition and how they would do this for us so we can bring this to you. So I lay that out for you. I want you to know the things that we're looking at. We're not just sitting back here and assuming everything's status quo. We're always out there looking for new ideas to help make you more efficient, us more efficient, drive electronic sales, help in this process, because we know more and more, especially in this individual market, they want to talk with you. They want your help, but they also sometimes want to enroll electronically, and we also want to do that most efficiently. So let me know if you have any other interest or feedback in that. Just shoot me an email or if you've got any other suggestions or ideas. But we're really excited about a firm that we're talking to right now. The next thing I want to talk about is Wellmark. Brenda and I were at a Wellmark for all general agencies on Monday this week. And I think you know this, but I want to make sure. They have made significant changes, as you know, in the last year. Think about what Wellmark has done with all of us in the last 12 months. From recontracting to giving you the opportunity to change your GA, to then changing the certification process, right? Remember, we were like, what? Certification? Is that Part D? No, that's not Part D. This is just, you need to get certified if you want to sell Wellmark, period. So they introduced their certification. And then they also rolled out, which you may or may not be familiar with, some minimum production requirements. And all this has been rolling out here in the last, really within the last 12 months. The minimum production requirements, now Wellmark is saying, we don't want just anybody to carry the cross and shield. We're going to put some minimum production requirements. This year, if you don't have at least 5 policies on the books, effective January 1, you're losing your Wellmark contract. So be aware of this out in the marketplace. You may have other people you talk to, whether it's the Big I, through NAPA, through health underwriters, folks that you visit with, they're losing their contracts from Wellmark. They might only have 1 or 2 or 3 or 4 policies. They're going to be either looking for a home for those policies, and they need to make that decision by the end of this month. It'll go effective. Their termination will be effective April 1st. But they need to get those policies moved to somebody that can service their clients. And if you want to negotiate some kind of a split arrangement with them, that's fine. So know that's going on. Know that if they don't move those 1 or 2 or 3 or 4 policies, they'll go to Wellmark direct. Now, does that mean you can't do an AOR? No. That client can ask to work with somebody who is appointed, and so you'd have to do an AOR to get that client back, to get it to an appointed agent. So just know that's going on. And here's the next thing. Next year, they're going to require you got to have at least 10 policies on the books. Now, don't get me wrong. I'm not talking about new sales. I'm talking about a book of business. So those of you that are with us with KHI and you're safe and you've kept your appointment, you've got at least year 5 policies on the books, and next year Wellmark believes you're going to need to have at least 10 policies on the books, and it could even go larger the year after that. The point is, we want, see the trend here? You're having to certify to maintain your Wellmark licensure. You're having to go through marketplace certification, Medicare Part D certification, and Medicare Advantage, and all these things. They want the best of the best. Wellmark wants those who are serious, and you know what? KHI does too. We want agents who are committed to the health insurance business. And for those of you that have been with me and with us for the last 2 years, this is exactly what I've been talking about. Only those that handle the strong will survive, right? If you're committed to the health insurance market, then get in, otherwise get out. And Wellmark's really forcing that point with minimum production requirements. So I wanted you to know that. And then secondly, they have modified all of the general agency's compensation. You guys are aware that you make your dollars and we make our override. That's how a wholesaler works. That's how we run our businesses, on our override. You guys also know that the override on Wellmark is 23%. You get 77%. This is dictated by Wellmark. They tell you exactly what you will make. If you deviate from that, they want documentation. So we will pay you exactly what Wellmark tells us to pay you. And you also know that whenever there's a carrier where they don't specify, then we work off of an 80-20 split. So with Wellmark, it's 77-23 on any other carrier or unspecified commissions like Wellmark Large Group, like Coventry, like UHC. Whenever it's not specified, then we just ask for an 80-20 split. So you determine your PM and then work the 80-20, okay? Now, having said that, I want you to know that Wellmark has taken of our override, they've taken a certain dollar amount, and I'll just tell you, it's 20% of our override they took away from us. They did this to all general agencies, and they're hanging that out there for us for production. But guess what else? One more thing. It's the annual survey. So this is my point to you today, that you will be surveyed by Wellmark again. You probably, if you remember getting the survey, they couldn't have sent it at a worse time last year. It was in about I believe it was September, September, October timeframe, and I'm like, are you kidding me? Right then, we were all ramping up with training. We were trying to get groups renewed. We were quoting out, et cetera, and they sent you a survey and asked you to survey KHI. So with that, luckily they didn't tie any money to that for us, but they did tie a baseline. So I think on average about 34% responded to that survey. That's really low results, obviously. So what we're asking you this year is to watch the survey. We will be letting you know when that comes out. We think it's going to come more like in the July timeframe maybe. So it's going to be this summer. I know you're going to be hopefully taking some time off. That's great. But we'll remind you, and we're asking you, please give us your feedback. And honestly, we want your feedback all year round. So please don't wait once a year to give us your feedback. You let us know how we're doing anytime. And I invite you, as you know, about every month, I invite you to please email me, Brenda, Andy, your feedback, any of our staff. Let us know your thoughts and feelings so we can improve and do better. But I just wanted you to know the surveys that are come from Wellmark this summer are tied to our compensation. So we're going to do everything we can. In fact, Brenda's suggestion, and thank you, Brenda, for that, we're going to give you the 7 questions. You guys, it's only 7 questions. It'll take you 5 minutes to do it. We're going to push out those questions so that you can see what they are, and we're going to be managing, of course, our business to those 7 questions to make sure we're doing everything we need to do, and they're the things we've been doing all along anyway. So enough about that, but I wanted you to know it's coming, and we'll continue to you'll hear more about that. And last but not least, I want to say congratulations to KHI's annual Grow Your Business Award recipients. Our dinner is a week from today up in Fort Dodge, and I just want to say congratulations. And so to all the folks listed here, thank you so much for your contributions. Please take a minute to look and see if your name is on the list, and if it is, congratulations. If your name is not on the list, I just want to say, figure out what you need to do to get on the list. These are our top agents. We take about the top 10% of our agents that grew their book of business rather in 2014. And so we want to say congratulations, and also we are awarding that night our top producers. we'll award our top 3 producers that night as well in terms of production from KHI. So we expect it's a great event, a great night. We'll have some carrier partners there as well to join in and do some networking with us and to support us in this event. So be watching. We're going to continue to do this because we think it's the right thing to do to help you stay focused on growing your agency's business. And so instead of just doing new sales or instead of doing a retention number, we're just doing a net growth. So did you grow in your number of policies in 2014? And this is the list. So congratulations to everybody that's on the list. Here are our top producers in growth and or in production. And thank you for all your support of KHI. You guys are awesome. And we are so blessed to work with such a great group of agents. So that's really all I had for our conference call today. So I'm going to go ahead and open up the lines and see if we've got some questions out here. And just feel free to use that little box on there to type your question or raise your hand. If I see someone that's raised their hand, I'll go ahead and unmute your microphone so you can speak. Make sure yours is unmuted as well. Okay, let me get this one. Thank you. I've got your question here, Tammy. Let me get it open. When will we hear more about eHelp? Give me a little bit more on your question there, Tammy. I'm not familiar, I guess, right now with eHelp. And comments too, you guys. If you have just a question or a comment. Looking to see here if anybody else has any questions or has a hand raised. Okay, you'll talk more offline. All right, that's fair enough, Tammy. Anything else? Told you this one would be probably a little bit shorter today than some of the others, but things are starting to quiet down just a little bit. Hey, maybe while I've got you on the line, don't forget if you're a member or not a member of Health Underwriters, we've got some continuing ed coming up on, we've got some ethics, some ERISA, and we're traveling around. We try to do a 3-city tour, so we go to either the Storm Lake area, I think that's where we are, Storm Lake, and then we're in Des Moines, and then we're over in Cedar Rapids. Also, don't forget that several of us from Health Underwriters are heading out to Washington, D.C. for Health Underwriters Capital Conference, February 23rd, 24th, and 25th. So I'll have some great updates for you at our next conference call in March about what we found out, what's happening nationally. And just also a couple things to keep in mind with the Supreme Court decision coming down, and we believe in June, about whether or not Iowans can even get the subsidy based on our federally facilitated marketplace and not a state-based exchange. Interesting, because I'm sure that'll be a point of conversation with our elected officials in Washington. What will happen? Will anyone in Washington come to the rescue of anyone in Iowa, or will they let us just, die on the vine, so to speak? I mean, think about that. If we've got individuals that we just moved from Coventry, or Co-Opportunity rather, over to Coventry. So we've got Coventry, they're getting their subsidy, and all of a sudden the Supreme Court decides that the way the law is written, that Iowans don't deserve a subsidy because we're on a federally facilitated marketplace. So what will happen with those folks? So I guess, wow, just more to come. stay tuned on that one in June. So yeah, and I'll share with you guys when I get back what the talking points were that we presented. We know that the 30-hour work week is going to be a big talking point. We know that we believe it passed the House, defining that as 40 instead of 30, but it was sitting in the Senate. I haven't heard any more, but I'm sure we'll hear more when we get out there. I'm sure there were some situations around the medical device tax and additional legislation there. So it'll be interesting to see what else has popped up. And I don't know about you guys, but I've got feedback I want to share with them on how can we provide more incentives for employers to offer qualified high-deductible health plans. I'd love to see that, so I'm going to bring that up as a suggestion if they haven't heard that one yet. But that would be great because there's still a lot of folks that aren't offering them. If we can give some additional incentives to even be offering those on a group platform, that would be great, or even additional incentives for individuals that buy. Okay, well, no one else is asking any other questions that I see. Raise your hand or ask a final question here before I wrap up on the call. And I don't see anything. As always, now I'm going to head out to a NAEFLA event actually later this morning here when we're done. And so I won't be sitting at my computer, but send me an email if you will. And if you have any questions or comments, as always, this will be posted on our website. Typically, Nicole gets them posted by Monday, so I get the recordings and the slides on. So you guys have a great weekend, and thank you, Paul. You too have a great weekend, and you guys take good care, and we'll be in touch. Talk soon. Bye-bye.